Hello and welcome. I'm Dr. Charlotte Middleton and I'm Healthshare's in-house GP. This month our topic for discussion is pregnancy and birth, and it's a topic that is very close to my heart. Not only am I the mum of 2 small children, but I've also been working in maternity, neonatal and paediatric medicine for the last 17 years. So I'm particularly passionate about this topic and more than happy to answer your questions this month. So the first topic that we're going to discuss today is pre-eclampsia. Now Lisa, one of our Facebook followers, has asked whether or not she's at an increased risk of developing pre-eclampsia in her second pregnancy. Now, just as a starter, I thought I'd talk a little bit about what actually pre-eclampsia is and then go into the discussion about second and subsequent pregnancies. So what we know is that preeclampsia is a severe pregnancy disorder characterised by high blood pressure, protein in the urine and severe fluid retention. It's actually one of the most common serious medical complications in pregnancy and affects around about 5 to 10% of pregnancies in Australia every year. Now, the mechanisms behind the condition are quite mysterious and we're not exactly sure what causes it. What we do know is that genetic factors and the placenta all can play a role in it developing. For also reasons unknown, preeclampsia tends to be more common in the first pregnancy rather than second or subsequent pregnancies. And the mother's blood pressure usually will go back to completely normal once the baby and the placenta are both delivered. So what makes women more at risk than others? Well, what we know is that women who are in their first pregnancy are more at risk. Those with a family history of preeclampsia are more at risk. Women who have diabetes, in particular insulin-dependent diabetes, women who are overweight or obese are also at increased risk, and women who have got multiple babies, so twins or more during their pregnancy. Now the problem with preeclampsia is that initially women often have no symptoms, and this is why it's particularly important that you attend all your antenatal visits so that your blood pressure and your urine can be measured for protein at each visit. If you do get some symptoms can be such things as dizziness, headache, visual disturbances such as flashing lights, or some pain just below the ribs can all be an indication that something is going wrong. Now Lisa, in particular reference to your question of are you at an increased risk in a second pregnancy, unfortunately the answer is yes, and it's in the order of about 20 to 25% increased risk that your second pregnancy you'll develop preeclampsia. Now this percentage can either decrease or increase depending on a number of factors. So for instance, if in your first pregnancy you develop preeclampsia very early on in the pregnancy, or it was a particularly severe form of preeclampsia, then you are more likely to develop preeclampsia again in your second and subsequent pregnancies. If however you've been able to manage some of the risk factors that might have predisposed you to that preeclampsia in the first pregnancy, then you might actually reduce your risk of developing preeclampsia in second or subsequent pregnancies. So what are those things, some of those things that you can help to prevent it? Well, these include losing weight if you are overweight or obese, managing your diabetes, so optimizing your blood sugar levels. If there's a family history of preeclampsia, perhaps asking your doctor to do some clotting factors or checking for any vascular disorders, and also just generally doing a thorough health check, getting your blood pressure done, your kidney function tested, all before you think about getting pregnant. And all of these things will help to reduce those chances of developing preeclampsia in your subsequent or second pregnancies. In terms of medications, there's been quite a lot of focus on complementary therapies. Calcium, fish oil supplements, vitamins C and E, and low-strength aspirin have all been studied for their effects on preventing preeclampsia. So far the research shows that only potentially vitamins C and E might confer some benefit, but a lot more research needs to be put into that area. A potent antioxidant CoQ10 is another area of interest in this, but also still needs more research. So Lisa, if you are already pregnant or you're hoping to become pregnant, I do wish you all the very best.